The federal government has mulled collaboration and proper implementation of policies to encourage local production of active pharmaceutical ingredients for drug manufacturing. The Minister of State for Health, Ekumakama Joseph Nkama, at a scientific workshop organized by the National Institute for Pharmaceutical Research and Development in collaboration with West Africa Postgraduate College of Pharmacists, disclosed the need for Africa to take a lead in the manufacturing of API for drug production. Benedict Uku has more on this report.
Active pharmaceutical ingredients, which are raw materials for production of drugs, has been the major drawback that has deprived Africa from taking the lead in the production of drugs globally.
The opportunity that also presents itself to us as a nation, if we cash in on that opportunity.
Pharmacists and experts in the industry said more collaboration and advocacy and also proper legal framework is needed to close the gap in the supply chain evolution of API in West Africa. At the scientific workshop of local manufacturing of API in West Africa, the Minister of State for Health, Ekumakama Joseph Nkama, called for more confidence in local APIs.
There is this apathy we have in Nigeria as a people, where we prefer foreign goods, foreign ingredients above the local ingredients. But it is for us to come to terms that what you are importing is available in Nigeria. Like this usual populace that saying that what is in Sokoto is in Sokoto. So let us have faith in these ingredients that they've been able to manufacture. And in the course of it, as we start using it, we find out that it's not just faith. Because when you talk about faith, you're talking about something you don't know, something you've not seen. That's why it's faith. Something you can't touch when you believe in it. So let's take it that they don't have belief by virtue of the fact they don't know. But now that they have faith in it, as they are using it, they will find the confidence to continue using it and save our country from excessive demand for foreign exchange that has not helped the country. And then we can come up with a policy to the, even if it means bringing it before the Federal Executive Council and the Federal Executive Council through the President's chairing council, approving that, such that since we have confidence in these APIs, what's the need of importing these other products? And once it's certified, as we have as an agency, NIPID has certified it as good for use, we can as well place it under custom restricted list that you can import these ingredients because we have it available in Nigeria. It's not just in Nigeria. So many other countries in Africa are beginning to work towards that direction, and even in Asia. What they can import, what they can produce, you cannot import because it's weighing heavily on our foreign exchange reserve, and it's not good for the country.
The workshop was hosted by the National Institute for Pharmaceutical Research and Development and the West Africa Postgraduate College of Pharmacists. The Director General NIPRID and President WAPSIP called for a conducive playing ground and support from the government for maximum push in API development.
Your Excellency, API is not the only area where NIPRID has led international innovation. We have also revitalized and re-strategized training for phytomedicinal practitioners by developing the contextual processing protocol, which we have used to train over 1,000 traditional medicine practitioners in close to 15 states of the Federation, and we aim to go to all 36 states of the Federation. Embedded in the contextual processing protocol are facilities that will enable us to use local people, including women and youth, and train them up in how to harness the leaves, the plants, and the herbs in their environment, process it to products that can be registered for the Nigerian market or exported.
We depend on government to start with. Because when you're coming from a developing country, you need all the support you can get, as much as possible, to be able to get the active ingredient from the research table into the pilot plant level and into the production.
The representative of the National Agency for Science and Engineering Infrastructure, Professor Umar Ibrahim Gaya, said more attention should be paid in the level of researchers.
We want to manufacture drugs. But how do we do that? That's why NASENI comes. We have a lot of researchers out there in the universities, and they are having postgraduate college of pharmacy. With them, the president is here. There are micro capabilities that can be obtained from these African countries that are in the neighborhood.
Others talked about strengthening of frameworks to ensure adequate active pharmaceutical ingredients in Africa.
The local manufacture of APIs in West Africa will enhance the region's preparedness in the face of a future pandemic, as well as contribute to the region's development of a sustainable, quality-focused drug manufacturing industry independent of API supply from foreign countries. The collaboration between the West African Postgraduate College of Pharmacists and the National Institute of Pharmaceutical Research and Development, with the aim of exploring the possibilities of manufacturing APIs in the West African region locally, will heighten the development and manufacture of APIs in West Africa, and this will go a long way in mitigating the supply chain risks in the region.
A significant gap exists in access to medicine in West Africa. It is hoped that more collaboration, proper legal framework, and advocacy will enhance the supply chain evolution of APIs in West Africa.